This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
They say that the hair is our crowning glory.
It helps us to fight or a primary defense against, infection. Bacteria may enter, through your nose or through your ears or even through your scalp. The hair can act as a first defense.
But the hair is also prone to some dangers.
Now it's summer, sobrang init, and actually the scalp is the one really exposed to the harmful rays of the sun kasi it's the topmost part of our body. So we'd probably have increased amounts of skin tumors or skin transformations in the scalp.
Your hair may be too oily and greasy, flat, stringy, or brittle. You may also be suffering from an itchy scalp because of dandruff. You may even find yourself losing some hair as you grow older. While there are many risk factors involved, such as prolonged exposure to the sun and heat, most of our daily habits actually damage our hair.
Other than that, if you subject your hair to chemical treatments, actually moderation probably is the word. So if it's in moderation, then it's probably okay. But if it's excessive, of course it can cause breakage, hair breakage or dryness, or worse, even irritation of the scalp.
What are the common hair problems? What can you do to take better care of your hair? All these and more tonight on MedTalk.
And joining us tonight is Dr. Peralta-Arambulo, a dermatologist and hair transplant specialist from the Asian Hair Restoration Center and the Medical City, and fellow of the Philippine Dermatological Society. Also joining us tonight is Dr. Teresita Ferraris, a dermatologist and cosmetic surgeon from the Makati Derm Surgery Center and Guapaha Medical Spa in General Santos City, and also a fellow of the Philippine Dermatological Society. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening, Angel. Thank you for
pretty
inviting
ladies.
us.
We're talking about hair tonight, hair care.
Okay.
Why do we have hair, and what are the many useful functions of our hair?
Okay. As what Dr. Teresa earlier said, it is for protection. It protects us from the sun. It protects us from the cold, from the air, because it also used as insulation, because it serves as a physical barrier between the external environment and the skin, and also it used as a sense organ. Tactile senses, Sabi nila na pag balbon ka, para kang medyo sensual. Yeah.
Okay. And the lack of hair, what does that mean? If kung balbon, sensual, the lack of hair is...
No, usually naman lahat ng tayo may hair sa body.
Kahit konti lang. No, you can't say naman talaga na yung isang tao has more than the other just by
that's right.
looking at it, no? Na superficial.
On average, a person has 5 million hairs. 5 million hairs.
All over
the body.
Okay.
Okay. And I just want to add
Yes,
the
please.
aesthetic function of the hair. It makes one beautiful.
Yes, that's right.
Yeah, it improves one's, kasi in our practice, they go for more hair. They want to have more hair, and because they want to improve how they look. So the same with the eyebrows and the eyelashes. So it frames the eyes, so it improves one's look.
They always say that it's our crowning glory kasi yan ang unang nakikita.
Exactly.
When someone is coming towards you, you see the hair. If it's healthy, if it's bouncy, if it's shiny.
That defines us.
And if it defines us, we also wonder, and we're also in awe of those whose hair grow fast. as compared to others, di ba? We always comment on, ang bilis humaba ng buhok mo. Mine, hindi masyado. Well, how does hair grow? Pare-pareho lang ba yan? Or do we see it in a different light depending on whose head it's on?
On the average also, yung growth of hair is about mga 1.25 centimeters a month.
Okay.
So, but in some cases, talagang iba nag-grow ng hair faster, iba naman slower. So, probably it's genetic.
Oh, genetic.
And maybe sometimes the growth of the hair is normal for everybody, but for others it is slower because they have illness. They have nutritional deficiency.
So is an illness and nutritional deficiency, therefore, mas mabagal humaba ang buhok nila? Because nga, they're not able to eat the proper nutrition to feed. So to speak, now to feed their hair.
Yeah, because if your nutrition is not so well, the nutrition is diverted to the body to give nutrients to the body instead of going to the hair.
Or it may cause also hair loss.
Yes.
So
Hair loss.
we'll talk about that, hair loss, in a little while, but we're talking about the body. So how does hair health affect the body in relation to overall well-being? Since we're talking about what you put inside your body affects your hair. So how does it affect our body, what we eat, and how we live, our certain lifestyle?
Or maybe you said, how does it affect the hair?
Yes.
It should be vice versa.
Okay, yes. How does it affect our hair?
Yeah, as I said earlier, if your body is not well, there's not much nutrients, then there is a diversion of the nutrients. That instead of going to the hair, it goes to the body.
And there are now may mga vitamins na can use. It's becoming popular, the biotin and the whey protein. I don't know really if they work, but there are anecdotal reports that they do really induce hair growth.
But based on
these are something that they can try. There are many products available outside, but you can try something that has been tried clinically. Meron na kasi mga clinical studies with the use of this whey protein and biotin, and you have to choose the right product.
So it improves our hair health kasi we want healthy, shiny, bouncy, and beautiful hair.
That's right.
But if we lack nutrition and we're exposed to the elements that make our hair dry, brittle, and damaged, which may lead to hair loss and sometimes an itchy scalp, we often suffer the consequences of not being confident, diba?
Yes, that's
about our hair. So what are the common hair problems that we face or that we have here in the Philippines?
Yeah, usually hair loss. Usually that's the common, that's a common problem common concern for men and women. Hair loss, and then there's the bacterial infection. There's an infection in the hair. Diseases that causes scaling and drying of the hair. And then there is like lice, kuto.
Is that common during the summer? Lice?
Yes. Yes.
Okay, lice. We
And
have hair
what
loss.
else, Lily?
Yeah,
Doc Lily?
in my practice kasi, I see a lot of hair loss problems. And these are medical conditions divided into permanent and temporary conditions, or scarring, non-scarring alopecia. So among the permanent is the hormone-induced, which is the androgenic alopecia. You see this everywhere you go. We have patients are with different patterns, and then it may affect male and female, okay? And this is the most common hair loss problem that I encounter. And then, of course, the second most common is the alopecia areata.
Yes.
And this is an autoimmune disease. The presentation is also different, maybe mild, and then you'll have involvement of the whole scalp hair. So if you don't have that, that will predispose you also to sun damage. So and then even all the hairs all over your body may be involved also. And then, not to forget, may mga habits din yung mga pasyente. I'm talking about my experience, what are the hairless problems that I encounter. And then, of course, there's telogen effluvium, and these are
What
caused.
is this?
Telogen effluvium is a hair loss problem. The manifestation ito yung diffuse, instead of may pattern, diffuse siya, kalat yung thinning problem niya.
Okay.
So this is caused by a lot of factors, no. Yung diet is one, no. Lack of protein, ito yung mga nagka-crash diet without protein in the diet, and there are also medical conditions like anemia, thyroid problem, and even stress can induce this hair loss problem, and a lot of things when a patient gets sick after surgery, after pregnancy, yung mga ganon. And it's important na self-limiting naman to, kaya lang, patient has to consult us dermatologists so that we can advise them what to do. Okay, and then of course, in some cases, I encounter yung mga the damage na hair caused by too aggressive chemical treatments.
Okay.
No? So, nagkakaroon ng hair breakage, and then, of course, allergic reaction to hair dyes. No? And then if not treated, of course, that can cause infection. Then there will be scarring of the scalp, permanent hair loss. And then meron din mga conditions na yung bang pulling ng hair, yung mga di ba?
Sobrang tight yung pag
Ponytail.
ponytail.
Or pag
traction
nag-braid.
alopecia naman. Oo, traction alopecia. Ito yung mga very common dun sa mga ano ba yun? Nagpo-ponytail.
Okay, so you're mentioning now the habits that people have that can lead to hair damage. You mentioned ponytail, and you mentioned
hair drying.
blow drying. Yes, Doc. Please tell us
too
more
much of
about what can damage our hair. What are our habits that can damage our hair?
But because usually when we blow dry our hair, the heat, causes a fragility of the hair. And so also I have read recently that Dr. Zodrelos, dermatologist from the U.S., and she said that it should be that we should blow dry our hair when it's not when it's wet, when it's already almost dry, and also not to use the heat so much, just low, and then you make it at least 12 inches away from your hair.
Oh, okay.
So anything excessive talaga.
Not so near.
Oo, kasi talaga you're going to damage it. Kung,
Exactly.
Parang your thinking is, if the nearer the gadget or the blow dryer to your head, the faster your hair is going. Matutuyo siya faster, pero matadamage din siya in the process.
Because the hair that is wet is at the time when the tendency for the hair to be really very the high tendency to be damaged.
So it becomes very
So anything
brittle,
excessive talaga, chemicals or heat, even yung too much handling the hair,
That's right.
Too much pressure, yung mga sa towel, di ba?
Yes.
Damaging to the hair.
Okay, doctors, we have a caller on the line, Jennifer Damasco. Hi, Jennifer. Good evening.
Magandang gabi po sa inyo, ma'am.
Magandang gabi. Yung tanong mo para sa mga doktor natin.
Yes, ma'am. Ask ko lang po, kasi yung buko po sobrang naglalagas po, lalo na po pagbasa siya. Since na uminom po ako ng gamot sa thyroid ko po. So, ang tanong ko po, paano ko po ba pipigilan yung pag-hair fall ko?
Salamat, Jennifer.
Yes po.
My first advice is count the number of hairs na fall off, no? Kasi merong allowed tayo, it's normal na mga 100 strands of hair ay mag-fall off, mag-fall out, no? So, kung within that range, it's still normal na huwag kang mabahala. And then, of course, kung may thyroid problem ka, it's part of, talagang affected yung hair talaga with thyroid problem. So, you have to go to your endocrinologist. Okay, so mention about it. Baka merong alternative medicines na you can try. Tingnan mo kung it will still be the same na kung makokontrol ang hair loss mo. And of course, we can prescribe medications na yung mga minoxidil, you can try. You can apply it to induce hair growth. But not to worry kasi temporary lang yung problema mo. After 3 months, 6 months, mag-grow back yung hair mo.
Okay. Okay, Jennifer?
Yes, ma'am.
Okay na, may tanong ka pa para sa mga doktor natin?
Wala na po, ma'am. Salamat po.
You're welcome. Salamat din sa pagtawag.
Okay po.
Alright. So doctors, we'll talk more about hair care when MedTalk returns.
Did you know that the only parts of your body that do not have hair follicles are your palms and the soles of your feet? Other places may look hairless, but there are actually small, fine hairs located there.
We're back here on MedTalk, still talking about hair care. This time, doctors, let's talk about dandruff and dry scalp. Dandruff, dry scalp, itchy scalp.
Yes.
Is it one and the same? Is there a similarity, a difference?
May mga conditions that cause yung itchy scalp at saka yung dandruff. One is seborrheic dermatitis at saka isang psoriasis. For seborrheic dermatitis, usually ang cause niyan kuminsan is, one is stress, right? And then kuminsan din genetically there is the tendency to have this seborrheic dermatitis. Sadly, seborrheic dermatitis is like there is no really cure, but you can control. Okay. Usually, the signs and symptoms of seborrheic dermatitis, aside from the itchy scalp or dryness of the scalp, which causes scaling, is scaling also on the eyebrows here, tapos yung scaling dito, and then scaling dito sa ears, and also dito sa beard, and sometimes on the chest. And, in fact, even kung talagang malala, they also have some on the axilla. And usually we give, because there's a history of, if we ask for medical history, they have history of stress. So psychologically, you have to give them support. And then we give them because also in seborrheic dermatitis, there is an evidence that it is caused by a yeast, by a fungal infection. So we give antifungal topicals, and also the shampoos, ketoconazole shampoos, miconazole cream. In my practice, I usually give miconazole cream at night for the fungal infection, and then I give hydrocortisone in the morning as an anti-inflammatory.
This is an extreme case of an itchy scalp already. Hindi lang siya dandruff. Hindi lang siya diagnosed as dandruff. So, Doc Lily, dandruff.
Yung dandruff kasi normal lang. Kasi, di ba, meron tayong tinatawag na epidermal turnover. No? So, talagang kailangan mag-shampoo ka. Kung hindi, mag-accumulate itong mga cells na to into flakes. Okay. No? May thin flakes. She talked about yung abnormal flaking, no? Kasi in what she talked about psoriasis and seborrheic, abnormal yung epidermal turnover, masyadong mabilis. So nag-accumulate yung yung scales into yung flakes into thick scales, no? Normally yung normal dandruff kasi fine lang siya, no? But if you don't shampoo your hair also, that will accumulate. So it's very important that you really have to shampoo your hair to remove all these.
They say also because there's sebum in our scalp, the oils, it gets stimulated, it comes out. So if we shampoo our hair often, then it's also not good. So what is the
Too much
medical
oiliness
advice?
is not good. It can precipitate more dandruff formation. And then of course she mentioned about the yeast, no? If it's very, that's normal, yung mga yeast sa atin. There's a normal flora talaga, yeast and bacteria sa scalp natin. But too much of that, because you don't shampoo, gives one a problem. So you have this itching, sensation, di ba, nangangati, and then inflammation. And then if you have, as you mentioned, yung seborrheic dermatitis and psoriasis, that can aggravate the condition. So you really need to use a good shampoo to remove all the scales, and you have to treat also the inflammation with steroids. Like that.
So if there's an inflammation, let's talk about the inflammation and treating it with steroids. Can it lead to a bigger health problem, bigger hair health problem like cancer?
No. No, it can just treat the inflammation. And of course, it's important that a patient knows how to use it. So may duration lang ang use of topical steroid, not oral steroid. No. It will never cause skin cancer.
Okay.
That's why it's very important for them to follow up to the dermatologist.
Yes.
Because there is a certain period of time that you can use the creams.
Our hair, our scalp gets immune to that. Is that true? That if we use a certain medicine or medication for a long period of time,
that is called tachyphylaxis. No, so there will come a time that it's not that effective anymore. So you really just have to shift to another kind of steroid. But there's no choice. Talagang yun lang ang treatment sa conditions
ng
seborrheic dermatitis and psoriasis.
But dandruff, does everybody have dandruff in their life?
Sometimes, in your lifetime,
yes,
meron talaga kung
meron
minsan.
talaga. Okay. And that one can be treated with the shampoos that have a certain ingredient to remove the flakes, and it won't come back. It won't come back again.
If there's much flake, you can apply like mineral oil or olive oil. You make it warm, and then you apply it, or you rub it on your scalp. Leave it for at least 30 minutes before shampooing.
That's a home remedy tip already.
To loosen the scales.
All right. So aside from dandruff and seborrheic dermatitis, another hair concern is gray hair. Others may have it more than the next person. Others may have it in their 20s. Others get it in their 50s. Why do we have gray hair? Why does it come out?
It's more genetic, and at the same time, it comes with age.
Yes.
Yeah.
But some teenagers have it already because
it's
it's genetic.
It's genetic.
Okay.
It's because as we advance in age, we're losing this melanin.
Yeah. The
So
production
it's
of
in
melanin.
the production of melanin is gone, so the hair grows as white or gray. In young patients naman, it's talagang genetic.
So it's normal for everyone to get gray hair, because sometimes men and women are in a panic. One day they look in the mirror and they see that their hair is all dark, and the next minute there's something there.
That's right. Smoking also adds to graying of the hair.
Okay. Why does it add to graying of the hair? Why smoking?
Maybe the nutrients, no? Or something. I really
No,
don't know. I'm not really sure.
In
But
my
it's said.
practice naman, yung smoking is bad for the growing
Of the
hair follicles. Kasi it depletes the oxygen, di ba?
Yes.
So that's the ano.
So those who get gray hair at a young age, does it continue on until they're older, or does it stop at a certain point because they got it at a young age?
It continues.
Okay, so you have to look at your
You have to
grandparents,
dye
your
your hair,
parents, and see
For
at what
us,
age they got it.
My mom at the age of 80, she has this old gray hair, but it looks good on her.
Yeah, I was about to say it. I'm sure it looks beautiful.
Yes.
Others look good with gray
Exactly.
hair. But thank God for the dyes that you can put on
And
your
also for the trend.
the trend.
Yeah.
Okay.
So the trend now, when you have this white hair, you just make it short, you
Tawag
make
doon?
this hairstyle so trendy, and then you're in.
So you shouldn't be worried about the gray hair, about
That's right.
covering it though, if it's a trend.
Parang highlight na rin, di ba?
But for those who would like to cover it, any other alternative? Because you mentioned earlier that sometimes others are allergic to the chemicals, to the dye that they put on their hair. So is there an alternative solution or treatment so that they don't get these allergies from the chemicals in covering their gray hair?
You can use vegetable dye. It's available commercially as henna.
Okay.
Yeah.
And then you have to look at the ingredients, no? Yung may mga talagang allergens. And the periphenyline diamide,
Yes.
PPD, and usually, dun allergic yung pasyente, no? So, and you can test also if you want to hair dye.
Where is it tested again?
The back of the elbows before, because there are some patients, the hair salon would say it's a vegetable dye, it's a, kasi usually metallic dyes, yung mga permanent dyes, no? It contains the mga allergens, usually allergic to ang patients. And then what you can do is recommend the vegetable dye. And if you're allergic to dye, syempre, natatakot kang i-try all these dyes. So to play safe, you can do the patch test, open patch test, that's how we call it. So you ilalagay mo dito back of the elbows or back of the ears. And then leave it there for mga 2 days. And kung walang reaction, kung walang rashes, that means it's safe to use that product.
But if you develop rashes when you use that certain dye, then you can do away with that and use the alternative vegetable dye.
That's right.
What do your patients have in your medical practice, the complaints of patients when they have other hair care concerns? Why do they have all these concerns and they still come to you and they don't treat it, talagang sila na mismo yung magti-treat, diba? Sometimes patients do it yourself at home and then mas lalong lumalala yung hair problem, like maybe oily hair, limp hair, dry, damage. So what advice can you give them?
Okay, for oily hair, I think you have to shampoo your hair more often. And for what type of shampoo, there's so many shampoos available outside.
Is there a certain ingredient that you should look out for when you buy shampoo for oily hair?
For oily hair, you use a deep cleansing shampoo, and the ingredients is like you look for sodium lauryl sulfate.
Okay.
LAURYL. And then the other one, sodium laurel. It's laureth sulfate. This is good for normal hair because it's not so deep cleansing.
And the damaged hair, you low pH shampoo also.
Yes,
I don't know
right.
if it's available. No? Low pH more of acidic side. No? So I don't know kung it's still available. I've been looking for that because I read about it and I go around. It was a long time ago. I've seen a low pH shampoo, but now I don't see it.
Okay, so low pH shampoo for dry hair.
Damaged hair, yung mga chemical damaged hair.
We're talking about damaged hair. We're talking about how to restore our hair back to life. When we come back, we'll talk about do-it-yourself, hair care tips and hair care remedies at home. All that and more when MedTalk returns.
Are you having a bad hair day? Is your hair behaving like crazy? Here are some quick hair care tips that you can try out. When going out, always wear a cap or a hat to protect your hair against the harsh rays of the sun. There are also many other proven techniques that use home-based products. For instance, raw egg is effective in moisturizing and treating oily hair. Olive oil and lemon juice, meanwhile, can help treat flaky and dry skin. The combination of honey, eggs, and mayonnaise is also a good solution to dry and frizzy hair. At the end of the day, it is important to seek the advice of an expert. They will help you identify the safe and right products that you can apply to your hair. They can also suggest other effective treatments and procedures you can try to help keep your hair healthy and beautiful.
We're back here on MedTalk, still talking about hair care. Doctors, it's summer, it's very hot, our hair tends to get damaged because of the sun's rays. How do we protect our hair, most especially our scalp, during this season?
For me, I use the wide brim hat, and there's an available hat that has sun protective factor. I get it from the States.
Okay.
Yeah, it's from sundayafternoons.com.
So
Yeah, it has lots of different kinds of trendy hats. So you can try that. And then, of course, Lily said there's an available hairspray for sunblock.
okay, so there's sunblock that
I don't
you
know
can
if
apply
it's
on your body and
available
on your
here
hair
in the
separate
Philippines,
pa?
but there's such a sunblock na hairspray siya.
Okay. About those that are available here in the country, a wide brim hat, we're a tropical country, we should always wear a hat.
Of course, yes.
Or a bandana just to protect our hair and our scalp.
And usually I tell my patients to wear an umbrella that is colored black, because the black color absorbs the ultraviolet rays.
Oh, okay. So those pretty colors and the pretty patterns, wag na muna, just the black one is advisable. Oh, I didn't know that. Okay. What other hair care tips can you give all our viewers out there?
Okay, since
During the season in
this
protecting our
summer,
scalp and hair.
the hair usually mas nagiging oily. The tendency is to shampoo every day, to shampoo more often. They have to be aware na too much shampooing is not good for the hair. And also yung too much handling, di ba? Yung masyadong dinadry na ganon.
Right.
Technically, nadi-destroy kasi yung covering of the hair, yung cuticle, so nagiging dull, di ba? And then, of course, when you comb your hair, okay, kung ang problema if your problem is thinning hair, so when you comb the hair, use a white tooth comb.
Yes.
White tooth comb para hindi masyadong...
I use that, even if I have short hair.
Para hindi, you don't pull the hair. Okay.
You mentioned too much shampooing during the season. It brings about oily hair. But too much exposure to the sun, can it cause skin cancer on our scalp?
If you don't have the hair, usually common to dun sa yung mga bald talaga, no? Wala silang protection. So it's important na to apply sunblock. Mag-apply silang sunblock kung wala silang hair. If they have short hair, shaved hair, di ba? And then if they're really bald, if you stay under the sun, to apply sunblock on the scalp, it's very much available because skin cancer can develop.
Doctors, we have a question from Facebook this time. I have an 8-year-old daughter who's into competitive swimming. She has damaged hair because of the chlorine in the pool. What product should I use?
I think there is available in the market that is shampoo for when you go to the pool, like for protection from chlorine. You should try looking for that. I had one before.
That's available. I've seen that in the market because, of course, summer, everyone's taking swimming classes. The swim cap.
Swim cap. Okay. And then right after swimming, shampoo your hair to remove the chlorine.
Rinse off right away.
Okay.
And maybe use a lot of conditioner. Hair conditioner is really useful.
So hair conditioner is you should always follow it up after your shampoo.
Right. It coats the hair cuticle.
Moisturize the hair.
Moisturize.
Okay, and what other tips can you give? You said moisturize the hair, shampoo, and follow up with a conditioner. What other tips can you share with us?
You handle your hair sparingly. Don't scratch too much, because scratching, it's not only you don't destroy you don't only destroy the scalp, but also you destroy the hair shaft, and it becomes fragile. And of course, as we said, I used brushes with a rounded tip.
Okay.
Okay, and then as they said, you stimulate your sebum when you brush your hair while it's wet, but it's not. The more you brush your hair when it's wet, the more you damage your hair.
Sleeping with your hair wet. What's your take on that?
That's not true.
They say it can damage your eyes.
No, it's not true.
That's not true. Okay. Sleeping in a ponytail.
Yes.
That can damage your hair.
Yeah, because it stretches your
traction.
scalp.
It can destroy the hair follicles. I think they're asking about the skin cancer. No, usually these are in patients with without hair, so you really have to see a dermatologist for us to search the scalp, especially if you always stay under the sun,
That's right.
too much exposed.
you
There are
advise to
early
put-
signs of skin cancer. They're not malignant, but they are pre-malignant, can degenerate into something malignant. So we look at the actinic keratosis. Usually ito yung mga rough, kala mo scales, kala mo dandruff. But actually, when we look closer, mga actinic keratosis na yon. So they have to be removed as soon as possible so that hindi na sila mag-develop into skin cancer.
So is it, what do we see in that? Is it red? Is there a patch?
It's rough and scaly.
Skin colored.
I see a lot of that kasi nga because of my practice, so they're bold, and I see a lot of growth on the scalp. So yung mga scaly, roughness, and inflamed also.
That needs medical attention right away
Yes.
para hindi na mag-lead sa skin
Yeah.
cancer. Doctors, we talked about damaged hair, what we can do. Lice is common during the summer. How
Yeah.
do we treat it? What do we use for it to go away and never come back?
Yeah, first you use yung comb na tightly, ang tawag yan, suyod.
Suyod ba yun?
Suyod.
Okay.
You use the suyod for the live lice.
Okay.
And then for the nits, yung lisa, you really have to remove it.
Wonderful.
And then you can use some lotions like the permethrin. You apply it on the scalp, on the hair, and then leave it for
For a few hours.
A few hours lang,
No,
no?
2 minutes. If it's a shampoo.
Few minutes lang yun, ano?
Minutes lang
It's a
yun.
shampoo. It's a
It's a
shampoo that
shampoo.
they leave.
And
And
then
then-
you leave it and then you rinse it. And then you have to repeat it after 7 to 10 days. Kasi yung lice, mamamatay yon. But then yung nits,
Still there.
yung mag-start pa lang, they live 7 to 10 days or up to 2 weeks yung mga lisa.
Does this
So-
need medical attention right away, or can you
Yeah,
cure
because
this at
it's
home?
contagious.
It's contagious, eh.
And then I just want to correct yung mga misconception.
Yes,
They
please.
think it's because it's summer, it's
Yeah.
caused by heat and sweat. Actually,
What is it caused?
They're parasites. So you get it from somebody. Common among kids, no?
Kids.
young, even old ones can get them. If you have used contaminated combs or towels, if you share towels with somebody who has lice, and then they think it's because it's mainit nga, but it's not. They are actually parasites. And then Tess mentioned about the use of permethrin. That's very effective. This is a shampoo.
Medicated shampoo.
Yummy.
You mentioned kids, no? Let's talk about the kids as well, because summer we also have to take care, as parents, no? We take care of their hair. How can we take care of the hair of our kids during summer? What are some tips that you can share with our viewers? Same ba with adults, or they need extra care when it comes to their hair?
They're young, like young skin. They're not that prone to damage yet.
And maybe sa shampoo, you use the baby shampoo, not as harsh as, the shampoo of the adults.
Kasi they play outside, and your scalp will smell, and
That's
it
why
gets oily.
and then you let them use sombrero too. Importante yun.
They're not exempted.
They're not exempted.
Kasi yung effect kasi ng sun, cumulative kasi yun eh. So, yung early exposure, tapos exposures to go, ang effect nun mas grabe. No? So, while they're young, protect na.
Exactly. So, 1-year-old, dapat nagsa-sunscreen na sila kasi cumulative ang effect ng ultraviolet rays.
We talk about damaged hair, oily hair, greasy hair, limp, lice. But what exactly, we haven't touched yata on what exactly healthy hair looks like. How does it look? Is it bouncy?
Shiny, bouncy.
Shiny.
Yeah?
Okay. I think they know it. Diba? So on television, they see bouncing hair.
Yes. And that on television, they see bouncy hair, shiny, healthy, beautiful hair. But behind that, there's so many things to consider. Also, aside from that, like you mentioned eating well. You mentioned the lifestyle that we should have.
Okay, so maybe yung treatments, no, very common now, yung mga young ones, 'di ba, teenagers, even teenagers, they go for hair dye na, 'di ba? Ano ba 'yan?
Well, it's a trend.
Before it was for old people lang. Di ba?
Yes,
Now
yes.
even the young ones, they go for this treatment. You make sure lang na ano. I think the recommendation from experienced and certified stylist or hair salon, you can do it like once a month, once every 2 months. Not you cannot do perming and hair dye
Yes,
at the same time.
Yes.
They're too much chemicals to destroy the hair.
And there are a lot of products out there that can help maintain your hair's health. Shampoo, conditioner, and leave-on treatments, even when they're still young.
Yes,
Dapat bata
yes,
pa lang, you should take good care of your
exactly.
hair already. How about split ends, doctors?
Split ends, you have to cut it.
No choice, you have to cut
That's
it.
right.
But those who have long hair, they try to tamper with their split ends and they just try to cut it. Will that come back if they cut it by themselves?
Kasi ano lang naman yun nag-i-start sa dulo when you really mishandle your hair. Like for example, yung too tight yung pag tie mo ng hair, and then when you use rubber bands, usually
that damages
kasi
the hair.
It damages the hair. And then when you use blow hair dryer that is so high yung heat, okay? And then
Is it better to dry your hair on in
siguro
front of
sa
the
air na
electric
lang.
fan
Maybe.
instead of a blow dryer?
Yeah.
It's gonna take longer, but maybe it can keep your
Kasi-
hair healthier.
Kasi you use daw
Cold
when you
hair.
dry,
You
just
use
use
the
your
cold hair
hair,
instead of hot hair.
your hair, your fingers, like this. Ganyan lang.
Okay.
Matagal lang.
But yun na nga, gaya ng sabi ko, it can save your hair's health.
Exactly.
No, pag cold air.
It won't save your time, but it will save your hair.
Doctors, we have a question from Twitter. Is it true that some vitamins, you mentioned this earlier, Doc Lily, can make your hair grow faster?
Yeah, before they're just myths, but now there are vitamins like whey proteins, even whey proteins and vitamins with biotin. Yeah, there are clinical studies now going on and reported cases that they can indeed induce hair growth.
Wow.
So we recommend this, but there are many available brands, diba?
Yes.
But you have to choose the ones that are supported by clinical studies.
We're talking of hair growth, hair transplant.
Yeah.
Is it common here in the country as
Yes.
hair plant specialists?
That's,
Is it common in the country? And when does one need a transplant?
Yeah, it's getting very popular. No, in hair transplantation, kasi the technique is now very good. No, because the result is natural. You can hardly see, can hardly notice that this patient underwent this procedure. No. And there are two ways to do it. No? Strip FUT and then FUE. No? And becoming popular now is the follicular unit extraction, where hair is taken individually. So the difference is they like it because downtime is less and there's scarring is undetectable. Scarring detectable because I use only very small punch, 1 millimeter punch to take the hair individually. It's more, it's difficult to do, but
the results are very
is
good.
Very good.
Doctors, we'll talk more about taking good care of our hair and what should we feed our hair. When we come back, MedTalk will talk about that.
Did you know that a normal person has around 100,000 hairs on the top of his or her head? Unless you are balding, you would normally lose up to 125 hair strands that are eventually replaced by new ones.
We're back here on MedTalk, still talking about hair care. So how important is diet and nutrition in hair health? Doc Tess?
It's really very important. Okay, so as I said earlier, we need good nutrition, proper nutrition for the hair.
May specific vegetables ba that we have to eat, and fruit and maybe nuts for our hair to
Wala
be
namang
healthy?
specific talaga, but just basic fruits and vegetables, green leafy vegetables. And then, yun na nga, yung fad diet, yung like, for example, there are other goes for high protein.
Yeah, since yung cause kasi ng hair loss, lack of protein also,
Yes,
diba, sa crash diet, and iron. So you have to eat include more protein in your diet, and iron containing food.
And then also lack of sleep.
Okay. Why lack of sleep? Why do we consider lack of sleep na magkaka-contribute siya to hair loss, hair damage, and all these other hair concerns?
Na-stress na rin yung...
Yeah, that's one form of
di ba?
stress, one manifestation, and stress ka. No, so that affects the hair.
So you really get hair loss, no, if you're stressed.
Yes.
You
It
really
is
link
conditioned,
that, no?
I mentioned it earlier, that's telogen effluvium. So, it's temporary kind of hair loss. Kasi yung hair, usually mga active hair called this anagen, and with a trigger factor, and number one is stress, no? Nagsishift yung anagen hair to resting phase, and that is telogen. So, it will look like you're losing hair kasi instead of 10% of your hair, which is 50,000,
yes.
10% of that, instead of losing 10% only of the 150,000, you're losing mga 300, and that's so alarming. You get scared. And the more na-stress ka, so ang patient kailangan, they consult talaga so that they know it's just a normal, it's just normal and temporary.
So normal and temporary na your hair is gonna, how many again?
100.
100 is normal.
A day.
But
Yes,
if you're
a day.
suffering, pag nag-ano ka ng, if you're have this condition, telogen effluvium, it could be more than, it could be more than 100. So what you do is a good history. Kailangan yung patient, you'll have to find out what's causing it. Kasi pwedeng nagkasakit, high fever, pregnancy nga, and lack of crash diet, lack of protein in the diet, anemic yung pasyente. So you just have to correct. Thyroid problem, you just have to correct.
Yes,
The problem.
doctor.
If there is an abrupt loss of hair, biglaan, then, tapos madami, then you think of telogen effluvium. Then that's the time you go to your dermatologist.
Yeah.
So, dun pa lang, that's when you seek medical advice, when it's more than the normal. Lalaglag. How about drinks? Is there a certain amount of fluid that we should drink to sustain the health of our hair? Or should we avoid certain drinks that can contribute to it being damaged? Water, how many? Is water a big
Siguro,
factor?
na lang din, yung normal na rin. Kasi if you drink a lot of water, it makes your body healthy. So kasama na rin siguro yung sa hair. It's like,
Improves
the
your
whole,
well-being,
your whole
so-
being.
Yes, you were about to say something, Doc Lily? No? Okay. Personally, how do you take care of your hair? Two of you, doctors.
Me, because I have fine hair. No, I
Me
don't
too.
use so much of conditioner because it flattens the hair. Okay, so once in a while I use it when it looks dry, and then I just use normal shampoo, Johnson's baby shampoo, and then if you have dandruff, you use anti-dandruff shampoo.
So that's
And
for
then
fine
I
hair.
avoid too much chemical treatment, so I don't like, if I can still hide the white hair.
Yeah, I have fine hair too, and I do
You both
dye
have
my
fine
hair.
hair,
Yeah, I
yeah.
do dye my hair. So I use the sulfate-free shampoo, and then
Is there
What
such
does a
Yes, there
sulfate-free
is
shampoo do to
Kerastase.
fine hair?
Oh,
Yeah.
Kerastase.
What does it
What
do
does
to
it
fine
do?
hair?
it lessens the damage. Yung parang sa ang chemical lang ba? Parang gano'n. Yes.
Alright.
And then ano ba?
So usually yung mga yung mga hair damage, when they come to our clinic, we give them this hydrogen peroxide rinse and NSS with NSS, and that is to remove the excess chemicals, and then they have to treat the irritation, the inflammation. Otherwise, it can damage the hair follicles and cause
And
permanent
usually
hair
when
loss.
this is what I learned from before, when patients come for hair loss, I usually give them like, I advise them to use yung Dove Pink na sabon. And then they what you call this, put it in a warm water para matunaw. And then use it as shampoo kasi di ba shiny pa rin yung Dove na ano.
It's very
Maganda, it works. Kasi less what you call this, less irritant sa hair.
And as the owner
How
of
about you, Angel?
me, I have wavy hair. I have wavy hair, so I massage my scalp to stimulate the sebum.
The hair,
Yes, I use Dove. Yes, like has
You do?
mentioned. Yes, and I use a wide tooth comb. I mean, you know, all the basics that you've mentioned. I also do because it crowns your glory, diba? Your hair crowns your glory, and it's the first thing, like the first the opening salvo that I mentioned. It's the first thing people see.
Yeah, it's your
the
crowning
first
glory.
thing
Yes.
people compliment.
I know.
So as the owner of your hair, you should be
Yes.
conscious and you should be mindful if there are changes that happen already.
And in my practice as a hair transplant specialist, they really, these patients who come for hair restoration, they are really affected by the loss of hair, the negative impact,
Yes.
psychological impact.
Yes.
So it really builds the self-confidence when the hair is restored. The
And you
crowning
know what?
glory
While
is
they're
restored.
treating their hair, I have this like something that you put on your hair, like yung parang
Hair
mga fibers and
fibers,
topic.
Wow.
Yeah.
There actually, if
There's a
we
lot to
have
do,
hair
huh?
loss
Wala, I didn't
concern,
realize. Okay.
they really have to come because you know the updates, what to recommend, what products available that they can help them. There are many ways to camouflage the thinning hair.
Exactly.
It may be non-surgical, it may be surgical. There's so many ways, so they just have to come in.
For
consult.
any hair care concern, they should seek the help of
Yes.
their doctor, their
Exactly.
dermatologist.
Because ano kasi, yung causes kasi ng hair loss, marami eh. Hindi lang isa. They always think it's androgenic alopecia, yung hormone-induced hair loss. But actually, there are so many factors that can induce hair loss. And they have to know it kasi iba-iba yung treatment kasi eh. How to treat this condition, iba-iba kasi yan.
And knowing it, you should also know the type of hair that you have. Wavy, straight, fine, curly, thick.
Yes,
And
talaga.
you've
That's
helped
genetic.
us. That's
Genetic.
genetic. So again, look to our
Genetic and-
parents
Yes,
and
that's
grandparents when we have our hair care concerns, and we'll take the cue from there. And when we have a bigger concern, then we consult the dermatologists
That's
like
right.
we did
Yes.
tonight. So thank you so much, Dr. Tess and Doc Lily, for enlightening us on how to take good care of our hair.
Thank you.
We'll see you again next Tuesday, 7 p.m. here on your scheduled on-air consultation on the Solar News Channel. I'm Angel Jacob. Good night.
Most of our daily habits actually damage our hair.
Other than that, if you subject your hair to like chemical treatments, actually moderation probably is the word. So if it's in moderation, then it's probably okay. But if it's excessive, of course it can cause breakage, hair breakage or dryness, or worse, even irritation of the scalp.
What are the common hair problems? What can you do to take better care of your hair? All these and more tonight on MedTalk.
And joining us tonight is Dr. Julieta Peralta-Arambulo, a dermatologist and hair transplant specialist from the Asian Hair Restoration Center and the Medical City, and fellow of the Philippine Dermatological Society. Also joining us tonight is Dr. Teresita Ferraris, a dermatologist and cosmetic surgeon from the Makati Derm Surgery Center and Guapaha Medical Spa in General Santos City, and also a fellow of the Philippine Dermatological Society. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening, Angel. Thank you
evening,
for
pretty
inviting
ladies.
us.
We're talking about hair tonight, hair care.
Okay.
Why do we have hair and what are the many useful functions of our hair?
Okay. As what Dr. Teresa earlier said, it is for protection. It protects us from the sun. It protects us from the cold, from the air, because it also used as insulation, because it serves as a physical barrier between the external environment and the skin, and also it used as a sense organ. No, tactile senses, you know.
Yes.
Sabi nila na pag balbon ka, para kang medyo sensual.
Okay. Consequences of not being confident, diba?
Yes, that's
about our hair. So, what are the common hair problems that we face or that we have here in the Philippines?
Yeah, usually hair loss. Usually that's the common, problem common concern for men and women. Hair loss, and then there's the bacterial infection. There's an infection in the hair. Diseases that causes scaling and drying of the hair. And then there is like lice, kuto.
Is that common during the summer? Like?
Yes. Yes.
Okay, lice. We
And
have hair
what
loss.
else, Lily?
Yeah,
Doc Lily?
in my practice kasi, I see a lot of hair loss problems. And these are medical conditions divided into permanent and temporary conditions, or scarring, non-scarring alopecia. So among the permanent is the hormone-induced, which is the androgenic alopecia. You see this everywhere you go. We have patients are with different patterns, and then it may affect male and female, okay? And this is the most common hair loss problem that I encounter. And then, of course, the second most common is the alopecia areata.
Yes.
And this is an autoimmune disease. The presentation is also different, maybe mild, and then you'll have involvement of the whole scalp hair. So if you don't have that, that will predispose you also to sun damage. So and then even all the hairs all over your body may be involved also. And then, not to forget, may mga habits din yung mga pasyente. I'm talking about my experience, what are the hair loss problems that I encounter. And then, of course, there's telogen effluvium. And these are caused, telogen effluvium is a hair loss problem.
And the lack of hair, what does that mean? If kung balbon, sensual, the lack of hair is...
No, usually naman lahat ng tayo may hair sa body.
Kahit
diba?
konti lang. No, you can't say naman talaga na yung isang tao has more than the other just by
that's right.
looking at it, no? Na superficial.
On average, a person has 5 million hairs. 5 million hairs.
All over
the body.
Okay.
Okay. And I just want to add
Yes,
the
please.
aesthetic function of the hair. It makes one beautiful.
Yes, that's right.
Yeah, it improves one's, kasi in our practice, they go for more hair. They want to have more hair, and because they want to improve how they look. So the same with the eyebrows and the eyelashes. So it frames the eyes, so it improves one's look.
They always say that it's our crowning glory kasi yan ang unang nakikita.
Exactly.
When someone is coming towards you, you see the hair. If it's healthy, if it's bouncy, if it's shiny.
That defines us.
And if it defines us, we also wonder, and we're also in awe of those whose hair grow fast. As compared to others, di ba? We always comment on, ang bilis humaba ng buhok mo. Mine, hindi masyado. But how does hair grow? Pare-pareho lang ba yan? Or do we see it in a different light depending on whose head it's on?
The average also, yung growth of hair is about mga 1.25 centimeters a month.
Okay.
So month. But in some cases, talagang iba nag-grow ng hair faster, iba naman slower. So probably it's genetic.
Oh, genetic.
And maybe sometimes the growth of the hair is normal for everybody, but for others it is slower because they have illness. They have nutritional deficiency.
So is an illness and nutritional deficiency, therefore, mas mabagal humaba ang buhok nila? Because nga, they're not able to eat the proper nutrition to feed.
Exactly.
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
They say that the hair is our crowning glory.
It helps us to fight, or a primary defense against, infection. Bacteria may enter, through your nose or through your ears or even through your scalp. The hair can act as a first defense.
But the hair is also prone to some dangers.
Now it's summer, sobrang init, and actually the scalp is the one really exposed to the harmful rays of the sun kasi it's the topmost part of our body. So we'd probably have increased amounts of skin tumors or skin transformations in the scalp.
Your hair may be too oily and greasy, flat, stringy, or brittle. You may also be suffering from an itchy scalp because of dandruff. You may even find yourself losing some hair as you grow older. While there are many risk factors involved, such as prolonged exposure to the sun and heat,
To feed their hair.
Because if your nutrition is not so well, the nutrition is diverted to the body to give nutrients to the body instead of going to the hair.
Or it may cause also hair loss.
Yes.
So
Hair
we'll,
loss.
we'll talk about that hair loss in a little while, but we're talking about the body. So how does hair health affect the body in relation to overall well-being? Since we're talking about what you put inside your body affects your hair. So how does it affect our body, what we eat and how we live, our certain lifestyle?
Or maybe you said, how does it affect the hair?
Yes.
It should be vice versa.
Okay, yes. How does it affect our hair?
Yeah, as I said earlier, if your body is not well, there's not much nutrients, then there is a diversion of the nutrients that instead of going to the hair, it goes to the body.
And there are now may mga vitamins na can use. It's becoming popular, the biotin
Yes.
and the whey protein. I don't know really if they work, but there are anecdotal reports that they do really induce hair growth.
But based
So
on
these are something that they can try. There are many products available outside, but you can try something that has been tried clinically. Meron na kasi mga clinical studies with the use of this whey protein
Yes,
and
that's right.
biotin and you have to choose the right product.
So it improves our hair health kasi we want healthy, shiny, bouncy, and beautiful hair.
That's right.
But if we lack nutrition and we're exposed to the elements that make our hair dry, brittle, and damaged, which may lead to hair loss and sometimes an itchy scalp, we often suffer the